Hi, very good afternoon to everyone present here today. It's a Saturday at 3 p.m. Thank you so much for joining in. Today's topic of discussion for us is on wisdom teeth and how, why, when do we address wisdom teeth and do you even need to save them? My name is Dr. Shazaan Nasar. I am from Oralia Dental Clinic. I'm the chief clinician and the general manager for the practice. This is our series with patient education, the public health program on how we go about informing the general public on different dental procedures and different issues that come up to us on daily practice. And we'd like to discuss them on this program. Today's topic, as a popular request that's come in, is for wisdom teeth. Now, there are some aspects of wisdom teeth that a lot of people don't seem to understand. Mostly it's because of fear, is what we feel. But we'd like to give you some basic information on what wisdom teeth, why do you have to care about them so much, when do you have to actually remove them, even if you want to remove them, what are the complications, what are the healing periods that you have to face when you remove a wisdom teeth, and is this a good idea to save a wisdom tooth or do you just need to remove them off? All right. Let's start with what wisdom teeth are. Wisdom teeth are the third set of molars that are available for everyone. Your molar teeth are the ones that help you in chewing, which is what everyone is mostly worried about. Wisdom teeth, unfortunately, does not help you in chewing because they're available right at the posterior end. Wisdom teeth may or may not get into the entire masticatory function for you. And they also recently, in the past decade or so, have been shown that they are considered as vestigial organs. Example of vestigial organs would be your nail, appendix, which is a gastrointestinal thing, and all these don't help you in any way. The only thing that they do is probably cause you more harm. Wisdom teeth is seen very commonly among young adults. It starts from 18 and up to 25. Most people are done and dusted with their issues with wisdom teeth. Now, what happens during that phase? Wisdom teeth, for most people, they grow out of the jaw, and once it's erupted, it's absolutely fine. You don't have to worry. Just have to maintain good oral hygiene, make sure there's no decay in that area, and you can maintain the teeth really well, preventing any kind of gross decay that will prevent you from taking the tooth out. Now, wisdom teeth is actually present at this end, which will be at the angle of your jaw, and depending on how your jaw has grown out and depending on the spacing, the teeth will erupt exactly in space or they might be under the bone. If the teeth don't erupt and if they're under the bone, this is called an impaction, right? The tooth is impacted and it's not erupted into the socket in your mouth. Now, impaction can be of different types. There's the common ones are mesoangular, which means it's more lifted towards the front. If it's distoangular, which means it's going towards the back. The horizontal is something where you'll have a flat wisdom teeth, and vertical is, of course, it's gone down vertically. How do you even know this? We take something called an orthopantomogram, which is an OPG. In some cases, we also take a CVCT scan. This is what tells us the position of the tooth. The CVCT tells us the proximity of the tooth to the nerve. Hence, we use all this information for planning surgery to make sure it's a seamless experience for the patient. Right? Most wisdom teeth procedures, patients, unfortunately here, at least what we're seeing in India, is that a lot of people don't remove their wisdom teeth in a proactive sense. Ideally, you should be if it's told by your dentist after doing the diagnostics, and if the dentist says, look, this is not in the right position, it will give you pain eventually, you need to spend some time thinking about it, be proactive, plan it and have it removed. Unfortunately here we don't see majority of the population doing this, but yes, we do have some people who actually contact us. They let us know that they want to plan their wisdom teeth extraction this week, and we take it further from there, right? Most of the time. Now, we've done with what wisdom teeth are and what sort of impact they have for you. Why do wisdom teeth hurt, right? Mainly because of the position they're in. What happens is they will be impinging onto the front tooth, which is your second molar. The second molar is what also helps you in chewing more functionally than your wisdom teeth. Now, if these are the two teeth which are stuck in between, there's food in between, it gets stuck there, and you cannot clean the area. There will be decay. It will get grossly decayed if it goes under the pulpal chamber. If it goes anywhere near the pulpal floor, you feel immense pain. So, for you to prevent all of this, it's best to remove the wisdom tooth that is causing all of this. Right? It might not be causing the issue directly, but it is definitely hindering your prophylaxis, which means you're cleaning the area, and all of that is being hindered by the wisdom teeth. This would be a good reason for you to remove it. In fact, this would be the only reason for you to remove it, unless it's broken. Fracture is always a reason why you need to remove the tooth. But if you feel your wisdom tooth is in between your normal oral hygiene maintenance, you will have to go ahead and remove it. There's no other way, because it will not help you in any other way. Proactiveness is number one, which is why we urge all our patients to go to the dentist twice every year. You take an OPG once a year. If you see there's a bit of a problem there, the dentist will red flag it for you. And after that, you can go ahead plan the removal of the wisdom teeth. Now, we will get to the part where we have a lot of patients who come to us and they tell us, I've heard rumors about removing my wisdom teeth. And rarely do we have people who come and tell us, I lose my wisdom over this, which is obviously not true. They have a lot of other hearsay from a lot of people. Some people just out of goodwill trying to scare them, telling them not to do it. But some are very genuine concerns, which we'd like to address, and we'll get to the later part of it, the later part of this webinar. Now, what are the complications in a wisdom tooth surgery? Look, generally you don't have any complications, depending on the planning of the case. If you have the orthopantomogram, which is the OPG before assessment, and in some cases, as per your clinician's advice, if you take a CBCT, you get to know the proximity of the nerve to your tooth, you're safe, you can plan it. The most common complication in wisdom teeth surgery is if your tooth is near the nerve, and while removing the nerve by mistake, or even sometimes it's very unavoidable, if there happens to be a small nick or a press on the nerve, patients feel temporary paresthesia. This can last up to 4 to 6 months, but it generally comes back to normal on vitamin supplements and all of that. It comes back. There's no irreversible damage. Rarely we even have things like temporary paresthesia with a wisdom teeth complication. There is some complication with healing, but this is completely patient based. After the wisdom teeth are removed, we generally give a set of instructions. I think the same thing we mentioned in our extractions webinar. After we do the extraction, we give some post-extraction instructions. You will need to follow them to the T as to how your dentist is telling you. And if you follow these, it shouldn't be a problem. If you don't, if they're simple things like no smoking, no using a straw, no rinsing, no spitting, things like this are not followed, it can lead to enlargement of the clot, and it can lead to a dry socket, which is generally very painful. Again, these are all not irreversible damages. These are things that you can fix and you can make it better, and you can take it from there. But it's always about planning. It's more about proactiveness. Every time, remember, when you go to your dentist before the surgery happens, you will probably have a meeting with your maxillofacial surgeon. Ask as many questions as you can, genuine doubts and questions, and I'm sure the surgeon will be very happy to clear the doubts, right? Now, with your healing period, how long does it take? Every wisdom tooth surgery, decayed or not, proactively removed, or you had to remove because of a pathology, will be given a suture, right? A wisdom teeth, especially the impaction, there will be a suture given. Sutures, once given, will take about 5 to 7 days for healing, and after that, based on assessment, it's maximum 5 to 7 days unless you're a diabetic. People who have diabetes and it's uncontrolled, the healing period is slightly prolonged. We'll have to take care of it better. You have to take your medication better. But following your prescription and giving a good amount of rest and time and some exercises that the dentist will give you, all of this will ensure that it heals really well without any issues. Now, the most important question of today's topic is, do I save my wisdom teeth? A lot of people come to us and say, it's fine, it's not giving me a problem. Do I save this? Do I remove this? Again, it's entirely based on assessment. If you happen to have your second molar and the first molar, which takes up most of your biting force and masticatory force, And if your wisdom teeth is angulated, if your dentist is telling you, yes, inevitably this will give you pain, either you have a choice of removing it when it gives you pain, or you go ahead and remove it right now. We very strongly recommend you remove it proactively, plan it before it gives you an issue. In most cases, we've seen it's very sad for us to see a lot of patients who come down and they're in excruciating pain. Yes, we do everything in our power. We relieve them of their pain. They're happy. They go back. But why would anybody want to put themselves through something like this, right? Why would you want to anticipate pain? Why would you want to take something like this and then feel the pain to that intensity and then go back to fixing it, either through pharmacological ways or surgical ways, right? We generally don't recommend saving wisdom teeth unless they're part of another procedure that you're doing. For example, I have wisdom teeth on this side, and the next tooth I have is my premolar. Unfortunately, I've lost both my molars. My wisdom teeth position, if they're not impacted, I can go for a therapeutic root canal procedure, which means I'm strengthening the tooth, giving a crown in that area. I'm using my wisdom tooth as an anchorage to give a 3 to 4 unit bridge. That helps me rehabilitate the entire portion that I've missed out on. In such cases, again, with better assessment, and if you think this is the right way to go, the clinician will advise you, and you can go ahead and save it in those cases. But otherwise, if they're impacted, there's no way for you to take an impacted tooth, which is a horizontal impaction, and straighten it out and reuse it for something. You can do it, but it's highly unlikely, and the longevity of the treatment might not be great. Prognosis for the treatment might not be great. Another question we have been asked with a lot of patients, they've been told to get root canals on wisdom teeth. Yes, you can do root canals on wisdom teeth if it applies to the previous scenario that I just mentioned. If the front tooth is broken, you might have to use do root canal, strengthen the tooth, use that as a support, as an anchorage, and you build your artificial teeth in between. It's called the pontic, and that's it. You can rehabilitate this space. In such cases, you can. Most people will tell you, let's do a filling, let's see as much as you can push this, you can get it done. The reason why most endodontists don't prefer doing a root canal for wisdom teeth is because the nerve structure, the canal morphology, all of this is very unique for different people. Every other tooth is relatively understandable. You can predict how the root shape will be, how the canals will be, how many canals will be, and all of that. But in wisdom teeth, it's very unpredictable, right? So you don't want to play with something that's unpredictable. You want to do, this is exact science. You want to do things which are exactly perfect from start to finish. You don't want to play with something unpredictable. But if you really have to, yes, you can put some time and energy, assess it, and then you can go ahead with it. Right? That's it. It was with wisdom teeth. We're not getting into the financial aspect of this because I believe it's a very clear-cut surgery. Not a lot of patients have come and complained to us or asked us opinion or advice on the financial aspect. So I think we are good with this. Thanks so much for listening. Are there any questions? Oh, hi, we have got some questions. Ashish saying, hi Ashish. Question 1, had a bad experience with wisdom tooth extraction. There was so much swelling. How can we avoid this? Okay. Now, one of the reasons why most people have wisdom teeth post-extraction swelling is because when you have an impacted tooth, like I mentioned, horizontal, vertical, and if it's mesioangular, disjoangular, based on the thing, it's not possible for you to open, expose the tooth and just luxate or pull it out. What you have to do is you have to trim a little bit of the bone around the tooth, giving it enough space for you to be able to move the tooth, nudge it a bit, and then you can lift it or you can split the tooth. Every time there's a little bit of bone that gets cut, as a healing response from the body, there will be a little bit of inflammation. Inflammation and swelling basically means that there'll be a lot of inflammatory fluid that rushes into that area, and it helps in fixing that area where the surgeries happened. Although this is something that leads to a lot of panic among a lot of patients, you don't have to worry. This is generally the case if you have to trim a lot of bone. Most of the time, your dentist and your maxillofacial surgeon who does this will give you a very strong anti-inflammatory, and they might even give you sometimes a corticosteroid. Sometimes they might even inject it in that area to prevent swelling and pain to be in that intensity. But they will inform you, saying there will be a little bit of swelling. Don't worry. They will give you a lot of exercises to do to improve mouth opening. it's just a very temporary thing. Ashish, sorry, you need to take this as a part of the healing process. It is not as painful as we've heard, but for some patients, pain tolerance is completely different from the other. There are some good antibiotics and painkillers that your doctor will prescribe to you. Please follow them. How you can avoid them is basically planning it better. But if it's in a position where we have to make a call, we have to take a call on should we split the tooth and take it off, should we trim the bone, it's called gutting. And if you have to do it, we take the call. But look at the bigger picture. The swelling does subside in 5 to 7 days. The pain can be managed a lot more better. Right? Hope this answers your question. Thank you so much. The next question is from Shanta. Hi doctor, I just want to know if we have pain again and again, better to have the wisdom tooth than better to have wisdom teeth than remove it. Okay, I think your question is if you have pain again and again, is it better to remove the tooth than have it inside the mouth? Yes, you're absolutely right. If it's giving you pain over and over again, taking antibiotics or anti-inflammatories will only delay the pain, it'll take the edge off, but you have to address the reason for the pain. The reason for the pain might not be the wisdom tooth by itself. It could be the tooth in front. This could be a referred pain. Maybe the wisdom tooth is actually sitting on a nerve. Maybe the decay can go down a little bit nerve. There are a full host of complications that can come up because of the wisdom tooth. If you've got pain more than a couple of times and after you go to the dentist for a checkup, if your dentist tells you go ahead and take it, it's not worth you putting up the pain, I think you should go with it. You should go with the advice and just go ahead and remove it. Okay. Thank you so much, Shanta. I hope that answers the question. We're at 3:21. Thank you so much for taking out the time. Do like our page, do give us some comments if you really like us to change the way our camera is placed, the way we address some topics, some of the topics that you'd like us to address more. Please do let us know. We'll be very happy to comply. Right? Have a great weekend. Thank you so much.